Hello, this is outline 4. I'm going to teach you about intestine, about small and large intestine. First part is small intestine. Intestine is convoluted tube which extend from the stomach, from the pylorus of the stomach to the anus. This is the anus, and it has two parts: small intestine and large intestine. Small intestine is part of the digestive system, which extends from the pylorus of the stomach to the ileocecal valva. Ileocecal valva is opening of the small intestine into the cecum, and small intestine is subdivided or divided into the three parts. First part is duodenum, then jejunum, and third part is ileum. Small intestine is situated in the peritoneal and abdominal and peritoneal cavity. It is situated in the central part of the abdominal cavity. Small intestine is surrounded by the large intestine, coils of large intestine, laterally and superiorly. Its anterior surface is covered by the apron-like part of the greater omentum and then anterior abdominal wall, and posteriorly coils of small intestine and mesentery, which is the mesentery of small intestine, are in contact with the posterior abdominal wall and primarily and secondarily retroperitoneal viscera. Pancreas secondarily, and kidney like primary retroperitoneal viscera. Duodenum is the first part of the small intestine. It is about 25 centimeters long. This is the 12 thumbs, and its coil has C shape, and duodenum is secondarily retroperitoneal, except its superior part, which is intraperitoneal, which is covered by the visceral peritoneum and which is connected to the porta hepatis by the hepatoduodenal ligament. Where is situated duodenum? Duodenum is situated at the level of the second, from the first to third or fourth lumbar vertebra. This is umbilical and epigastric region, and it is situated in the supracolic compartment, superior part, pars superior and superior part of the pars descending part, superior part of the duodenum and superior part of the descending part of the duodenum are situated in the supracolic compartment, and this horizontal ascending part and inferior part of the descending colon is situated in the infracolic compartment. Duodenum has a C-shaped course, and it is divided into the four parts. The upper part, first part, is a superior part, then descending part. Between superior and descending part is the superior duodenal flexure, then horizontal part. On the between this descending and horizontal part is inferior duodenal flexure, and ascending part of the duodenum, and duodenum terminates in the duodenal flexure. Superior or first part of the duodenum, it arising from the it is rising from the pylorus of the stomach, then passes on the right posteriorly and superiorly, and at the neck of the gallbladder makes sharp bends inferiorly, and this is the superior duodenal flexure. A superior part is intraperitoneal, and it is connected by the hepatoduodenal ligament to the porta of hepatic. Hepatoduodenal ligament is part of the lesser omentum. Descending part is the second part of the second segment of the duodenum, and it passes inferiorly and opposite to the third and fourth lumbar vertebra. Also, at the right side of the fourth lumbar vertebra, it makes inferior duodenal flexure. That descending part is in relation with the medial margin of the kidney and part of the right kidney and part of the right urinary system. Then internal surface of the descending part is relation with the head of the pancreas and two ducts, bile duct and pancreatic duct, in the wall of the descending part, fuse and form the hepatopancreatic ampulla of Vater ampulla, and this ampulla opens on the major duodenal papilla. Horizontal part crosses vertebral column, and at the left side of the abdominal aorta and head of the pancreas, it ascends and forms the ascending part. This is the fourth part of the duodenum. Ascending part ends like duodenojejunal flexure, which is the border between the duodenum and jejunum. Duodenum has the widest lumen and the thickest wall of any other region of the small intestine. Internal surface presents the different structures. First, that is the major duodenal papilla. This is the major duodenal papilla. This is the common entrance of the bile duct and pancreatic duct. This is the opening of the hepatopancreatic ampulla. Above the about 1 centimeter, 1.5, above the major is minor duodenal papilla, and accessory bile duct can be open at this minor duodenal papilla. Then internal surface presents circular folds. They are absent in the first superior part of the duodenum, and in the other parts are large and numerous. Also, mucus presents the intestinal villi, then submucosal duodenal glands, Brunner's glands, and tubular intestinal glands or intestinal crypts of Lieberkini, and lymphatic follicles. The second and third part of the duodenum are the jejunum and ileum. The jejunum begins at the level of the duodenojejunal flexure on the left side of the third lumbar vertebra, and ileum continues and ends in the right iliac fosse, in the opening of the with the opening in the cecum, large intestine, which is named ileocecal valve. This is convolute tube which extend from the duodenogenital flexure to the ileocecal opening orifice, and this part is about 5 to 6 meters in length. The junction area between the jejunum and the ileum, these two parts, has no gross morphological points to distinguish. Only histological features are changed, and this is the we can tell that this is the jejunum and ileum. Different. Jejunum has wider rumen, thicker wall, and more prominent circular folds. Ileum has a few circular folds, aggregated lymphoid follicles, Wehr's patches, and it is terminates in the right fossa by joining the medial aspect of the cecum at ileocecal valve. This part of the small intestine, jejunum, ileum, are intraperitoneal viscera organs. They are completely covered by the visceral peritoneum, and they are connected to the posterior abdominal wall by the mesentery. Mesentery is double-layer peritoneal fold. It has intestinal, this is the peritoneal fold of the small intestine, and it has two margins, root of mesentery. This is the place of the connection, attachment of the mesentery to the posterior wall, and the other intestinal border margin, which is about 6 centimeters in length. Root is long about 50 centimeters and extend from the duodenojejunal flexion. It crosses the horizontal part of the duodenum, then aorta, inferior vena cave, right uterus, of a right ureter, and psoas major muscle, and at the level of the right sacroiliac joint is ends. This is the mesentery. Between two layers of the mesentery, there are the blood vessels, lymph vessels, and nerves and lymph follicles. Wall of the small intestine consists of the 4 layers. First is the mucus, which this is the innermost layer, which lines the lumen of the small intestine. Then the second one is the submucus. Then muscular layer, which consists of the 2 layers of the smooth muscle cells. External thin longitudinal layer, longitudinal muscular fibers, and internal circular layer. This layer is thick circular layer, and outermost layer is serous. This is the visceral peritoneum. Near the at the duodenum, its surface is covered by adventitia, that is the loose connective tissue. Anterior surface is covered by the parietal peritoneum, but lateral and posteriorly is covered by the adventitia and posteriorly told fascia, because the most part of the duodenum is secondarily retroperitoneal part organ. Mucus of the small intestine has different features in the proximal and distal part of the small intestine. In the proximal part of the small intestine, mucus is thick and very vascular. In the distal part is thin and less vascular, and mucus form presents different structures. These are the circular fold, intestinal. These are the circular fold, intestinal villi, and lymphoid follicles. Circular folds are valves of Kerckring. These are the circular folds. These are the folds of the mucus. They have the core of submucus. This is the folds of the mucus. It's project into the lumen of the intestine, and it's project transversely or oblique to the long axis. And the function of these circular folds to enlarge the surface area for the absorption of the molecules of the food. These circular folds, they appear 2.5 to 5 centimeter beyond the parus, and this first part of the duodenum, superior part of the duodenum, its internal surface doesn't present a circular folds. Folds absent is the superior part of the duodenum. Then circular folds diminish from duodenum to the ileum and almost disappear completely in the distal ileum. These are circular folds, only small and a few these circular folds. This is the circular folds in the jejunum, and in the duodenum there are the most prominent and most and numerous. Intestinal villi is the second product of the mucus. This is the intestinal villi are a finger-like protrusion or process of the mucus, and finger-like these intestinal villi give the velvet texture of the surface of the intestine. Intestinal villi increase the absorptive area about 8 times. Intestinal villi are large and numerous in the proximal part of the small intestine, duodenum, jejunum, and smaller fewer in the ileum. And what structure of this intestinal villi? This is epithelium, which covers the surface of the villi, and these are a core of delicate connective tissue with the lymph vessel, with the blind central artery, also, and vessel is blind, and then muscular, smooth muscular cells and nerves. This is the structure of the core of the intestinal villi. Mucus of the small intestine, lamina propria of the mucus, has plasma cells and lymphocytes, and these plasma cells and lymphocytes are clustered in the lymphatic or lymphoid follicles. There are two types of the lymphoid follicles: solitary lymphoid follicles, and the other are aggregated lymphoid follicles, which form the pairs patches. Solitary follicles are numerous and large in duodenum and jejunum, and they are situated along length of the intestine mucus. Aggregated are situated in the terminal part, are situated in the ileum. It contains 10 to 260 follicles. It is about 2 to 10 centimeters in length. They are only occasionally in the duodenum. In the jejunum they are small in few, but in the ileum, especially in the terminal ileum, they are most numerous and largest, about 10 centimeter, 2 to 10 centimeter in length. These pair patches are situated on the this is opposite to the intestinal margin of the small intestine, opposite to the place attachment of the mesentery. Blood supply of the small intestine. There are different arteries for the different parts of the small intestine. Duodenum receive blood supply from the superior and inferior pancreatico-duodenal artery. This is superior pancreatico-duodenal artery is the branch of the gastro-duodenal artery. This is the gastro-duodenal artery, and superior pancreatic artery, it has two branches, anterior and posterior, and these two branches, they form the anastomotic vessels and anastomotic network on the anterior and posterior surface of the head of the pancreas, and also these two ramus are situated near the duodenum. Also inferior posterior pancreatic inferior pancreatico-duodenal artery. This artery is from the superior mesenteric artery. It has also anterior. Small intestine receive blood supply from the branches of the superior mesenteric artery. This is superior mesenteric artery. These are the left branches of this artery. These are intestinal arteries, jejunal and ileal arteries from the superior mesenteric arteries. These arteries they have the two terminal branches, ascending and descending branch, and these branches form anastomotic arcade with the arteries above and below, and there are one or two arcades in the between the layers, peritoneal layers of the mesentery. This is the arteries and arcades, and terminal branches of the arcades are vasa recta or straight arteries. This is the final supply. This is the straight arteries, and these are the arcades, arterial arcades. Each artery has two branches, for the one branch for the branch of the artery above or below. Veins follows the arteries. This is the intestinal veins, jejunal and ileal veins, which are the tributary of the superior mesenteric vein, and this vein is tributary of the portal vein. Innervation. Parasympathetic innervation of the small intestine is from the vagus nerve, a sympathetic innervation from the celiac plexus and celiac ganglia, and superior mesenteric plexus celiac plexus receive thoracic spine nerves and give rise for the superior mesenteric plexus for the small intestine. Also in the wall of the small intestine there are two enteric plexuses. These two plexuses are enteric plexus. This is the mesenteric plexus between the inside the muscular layer, and submucosal plexus in the submucus. First mesenteric is Auerbach's plexus, and the other is the Meissner plexus.